Hi, my name is Anastasia Malaspina, and this is for Public Health 2 BIC. I'm going to be going over the outbreak of Salmonella and these infections that were linked to tomatoes. It was multi-state in 2006, and yeah, let's get into it. So, some background information. In total, there's 183 cases in 21 states, and they were mostly on the East Coast, and this included, Massachusetts was a big one, New Hampshire was a big one, and Connecticut as well. There's one case in Washington, technically, so it was a little bit on the West Coast, but mainly on the East Coast, as you can see on the diagram here. Some symptoms that were occurring were fever and diarrhea. That was mostly all of them. And the investigators that wanted to find these implicated tomatoes, they actually found that it was going to be on the eastern shore of Virginia in 2006. The average age was also of these patients were also 34 years old, and it was actually more prevalent in females rather than males, which is 57% females. So, taking a look at the analysis of the situation. Obviously, 2006 didn't have as many advancements as nowadays. We have a lot more technology, a lot more social media that we could use to kind of spread word about maybe any potential outbreaks, like in COVID or whatnot. But in 2006, we could expect them to not be as communicative. And so, of course, they had limited social media, fewer regulations on food handling, and appropriate food temperatures. And so not only did the FDA have like limited resources compared to today, but they also had to keep in mind what populations and communities were going to be affected. And the number one population I would say is definitely the farmers. Economically, they are the ones who are going to be hit the hardest. Their crops, their tomatoes that they sell are going to be seen differently after this outbreak, and that's actually what happened in 2006. People were a little bit scared to buy tomatoes afterwards because they didn't want salmonella. And so some SWOT analysis that I have done, the strength that the FDA did in 2006 was tracing the outbreak in Virginia. I think it's always good to find that source. One weakness, I would say, lack of technology definitely hurts our efficiency and being able to just get results as quickly as possible. One opportunity that they had was being able to test irrigation ponds, which I thought was great. I'll talk about that later on, but the irrigation systems were actually one of the causes for these tomato diseases or infections. And one threat that happened was a farmer economy, in their tomato crops. All right, so the root causes. So, as I said before, it was believed to be caused due to poor irrigation, which are water systems, and in fields in Virginia, leading to a small contamination, and it actually grew into a large contamination due to tomatoes being packed through trucks not well. So these packing and shipping, they basically just piled all the tomatoes together. And yeah, that's kind of how they all spread. One bad tomato leads to the whole truck full of tomatoes being bad. And so here I also just provided a little diagram of the confirmed cases going up, and you can kind of see where the rise began. It was kind of late September. Yeah. All right, so analyzing alternatives. So, first alternative, enforcing regulations that could possibly be over the top and exaggerate the effects that come from these tomatoes. That could kind of force people to be overprotective about their tomatoes and crops in general. And this will at least make sure that they pass regulations that are actually needed. And so just not fully lying, but just exaggerating and being like this, just telling the straight up facts and being like this could happen and this could happen. And so yeah, and another alternative would be just keeping the public educated about current happenings and always providing new information as soon as the FDA gets it. Public being informed is the number one way to kind of prevent these diseases. And so the model I picked to kind of really describe this idea is the health belief model. And I think it's just basically when we modify these variables and really allow people to perceive these ideas with seriousness, then they find the threat. they've find the benefits, and that's when they'll actually start doing the health promoting behavior, and you'll start implementing the cues to action. So, recommendations. First recommendation is the separation of storage. You know, having all of these tomatoes from all over, from a bunch of different farms all together, way easier to start spreading some, what, who knows what diseases or illnesses. And the second recommendation is washing all foods at 10 degrees higher than item's temperature. And so, why I say higher is actually because cold water causes air cells in the tomato to contract. And so, that basically is like creating a vacuum, drawing water into the tomato. This is one of the ways that, like, in any like infection could just easily be integrated into a tomato via water. All right, so what is our action plan? I would say definitely, ensuring maintenance systems regarding transportation, products, cleanliness, just really being strict on those regulations and taking technology into a more ideal plan. Kind of prioritizing technology, spreading the word, educating. And so, who's going to be involved? Transporters, farmers, consumers. I think that covers almost everybody. And so, what we would need from each of these types of groups, transporters would needed to be ensuring the effective maintenance systems are in place, like cleanliness of transportation, individual hygiene, and product prior to packaging. And that can include like washing, separating during packaging, etc. Farmers would need to ensure appropriate maintenance of all products grown, so just keeping their crops healthy. And then consumers, of course, just thoroughly cleaning, storing, and cooking products as well. All right, so if you haven't gotten like a full grasp on our plan and like which solution would be more efficient, it's hard to say. My idealistic plan would be, using prevention with stricter regulations, taking advantage of technology, strict protocols, leaving no groups out during outbreak. The actual plan, I think the public was kind of informed a little bit too late. Most of the tomatoes had been consumed by the time the FDA was involved, and I mean, the rest that were left were thrown out. But yeah, I mean, I think they started, testing irrigation ponds after everyone had already gotten over the sickness and whatnot. And so I think there definitely should have been more preventative action. And this kind of leads into my opinion about how the FDA should be continuously, updating these regulations rather than waiting for outbreaks to arise. And so here's my works cited page. I got it from the CDC, Human Foods Program, and Minnesota Department of Health. Thank you for watching.